So when you're entertaining the thought of having epilepsy surgery, or someone mentions that to you, your first response shouldn't be of fear. It really should be of curiosity. And then some probing questions, in-depth questions about, well, what type are we talking about for me, my specific type of epilepsy as me, the patient? And then what does it look like? What is the journey going to be? And please outline that for me. There are many types of surgery for epilepsy. Some are fairly minimally invasive. They don't involve any surgery on the brain directly. Some are much more invasive and involve several surgical episodes where there are different types of monitoring or electrodes placed, and then that can even mean more refined electrodes placed. Hopefully, some of those lead to a resection or removal of bad brain tissue. And it's that bad brain tissue that's found to cause the seizures in some patients. There's also a type of surgery that helps modify or control the epilepsy that works in conjunction with medications. It may not produce a cure, but it's part of the whole package. And if you're a patient, you really want the whole package of everything that I can get to help me control my epilepsy.
So it's always important to do a risk-benefit analysis when we're discussing how to treat somebody's epilepsy. What we consider relatively low risk to somebody else may not be. So for instance, there are some types of surgery which maybe would have an excellent chance at having a patient be seizure-free, but along with that could come an impairment in memory. That memory impairment to us may seem quite mild, but to the patient experiencing it may be a problem.
Everything has two sides to a coin. The patient needs to be an active part in the decision-making process. You need to make sure that they understand the benefits of ultimately undergoing a procedure that can render them where they want to be, which is oftentimes seizure-free, versus the risks that may occur with surgery, with diet, with various types of neurostimulation, or with ongoing medicine, independent of surgery. There are risks involved with any type of treatment path that you take, and the ramifications at the end of the day are based on what side effects are they going to occur, what immediate problems could potentially happen from surgery, how does all that decision-making affect their quality of life? Because that's ultimately what we want to improve. We want to improve quality of life. And by sharing the decision-making process, the patient is better educated and informed and understands that balance between risk and benefit.
People approach independence and how surgery versus seizures will affect their daily life in different ways. Some people realize that seizures are affecting their daily life much more than a surgery would, and as long as that surgery is likely to help them be free of seizures, then they're very willing to have it done. Other people are much more concerned about the risk of the surgery itself, and maybe they're not as confident in their overall likelihood of being seizure-free with surgery. And that's something that's important to take into account. At the end of the day, anybody undergoing surgery for seizures or epilepsy needs to be comfortable with the decision that they're making.